Good afternoon, and welcome to the Johns Hopkins 30-minute COVID-19 briefing, where we provide live insights from the experts who lead our work at the Johns Hopkins Coronavirus Resource Center. For the next half hour, we'll focus on what you need to know right now about the COVID-19 pandemic and public health responses. As part of this briefing, we'll have an opportunity for live Q&A with our experts, and we'll be offering these 30-minute briefings regularly on Fridays at 12 p.m. I'm Dr. Lainie Rutkow, a professor at the Johns Hopkins Bloomberg School of Public Health, and I'm part of the leadership team for the Johns Hopkins Coronavirus Resource Center. We'll be providing answers in real time today, so please submit your questions in the box at the bottom of your screen. Before I introduce today's guests, I want to briefly summarize some of the trends that we're seeing. It's hard to believe, but it was 1 year ago today that our global map was launched. I'm going to share some slides, starting off with what the global map looks like today. And I'm sure many of you remember when this map was first launched, these red dots were isolated to a small area in China. And as we all know, unfortunately, those red dots continue to creep across the globe. Very quickly, the United States continues to lead the world, unfortunately, in new daily cases. And you can see this green line is the United States. It does appear that we may be at a turning point, but of course, even with a slight decrease in cases, we're still seeing many, many more hundreds of thousands of cases per day than we would like. Behind the United States, towards the bottom of this slide, in orange, you see Brazil, and you also see in red the UK. In the UK, it appears also may have hit a turning point. I also wanted to mention that since we were last together for one of these briefings, actually just after our briefing last Friday, the United States reached over 400,000 total deaths due to COVID-19. On the right-hand side of this slide, you can see that the month of January is tracking to be the deadliest month in the pandemic in the US, and in all likelihood, we will also have the most new cases by the end of the month of January that we've seen in any single given month during the pandemic. Finally, I'd like to use these briefings to share with you new data visualizations that we're developing on the site. So very quickly, what you see right here is our updated vaccine tracker, where we are following vaccination progress in all of the states. The key pieces of information here are that whenever it is publicly reported, we're sharing the number of doses of vaccine that have been administered in a state, the number of people who are fully vaccinated, meaning that they've received 2 doses of either the Pfizer or Moderna vaccines. And finally, we're showing the percentage of that state's population that's been fully vaccinated. I will note that to date, no state has vaccinated more than 2% of its population. It's actually Alaska, which you see right here, that's vaccinated the largest percentage of its population, and that's just under 2%. I'm now going to turn to our guests today. We're fortunate to be joined by 2 of our experts from the Coronavirus Resource Center. First is Dr. Brian Garibaldi. He's the medical director of the Johns Hopkins Biocontainment Unit, and he's an associate professor at the Johns Hopkins School of Medicine. He's going to give an update about treatment of COVID patients. We're also joined by Dr. Bill Moss, who's the executive director of the Johns Hopkins International Vaccine Access Center and a professor at the Johns Hopkins Bloomberg School of Public Health. Bill will give an update about COVID-19 vaccines. I'm now going to turn to each of our speakers for a brief overview. Brian, you're a frontline provider. You've been on the front line since the earliest days of the pandemic. We're now seeing record numbers of deaths, health systems throughout the country experiencing capacity challenges, and multiple new variants of the virus. Can you talk us through what you're seeing?
Thanks, Lainie. We continue to unfortunately see here in Maryland record highs or near record highs of the number of patients who are hospitalized on a daily basis with coronavirus, and near record highs in terms of ICU utilization. We're hopeful that as we start to see cases coming down across the country, that hospitalizations and deaths will start to come down as well. But I think for the next several weeks, we anticipate to continue to see high utilization of those services. And many health systems that have been overwhelmed will continue to be overwhelmed. And there's emerging data now that when health systems are overwhelmed, that leads to worse outcomes among patients, particularly those who get admitted to the intensive care unit. The other thing that I worry about that we're also seeing is that even patients who are surviving from their infection, have residual effects, and this is true of what we call long haulers, or people who maybe even didn't have severe disease but have chronic symptoms months out. But we're also seeing patients in the hospital who are no longer infectious with COVID, so they don't have to be under strict isolation anymore, but they're still requiring high levels of supportive care, and in many cases are stuck on a breathing machine for weeks and even months at a time. And we've even had to open special units to take care of patients who are in that situation where they're no longer infected with COVID, but still require intensive level care.
Thanks, Brian. Before I turn to Bill, I want to remind our audience to please submit questions for our experts in the box at the bottom of your screen. After Bill gives us a brief overview, we will immediately move into Q&A. Bill, we continue to learn more about the two available COVID vaccines, the Pfizer and the Moderna vaccines, as well as the potential for new vaccines in the coming months. Can you talk us through the latest developments?
Yes, thank you, Lainie. And there's obviously a lot happening here. As you said, we've been using both the Pfizer and the Moderna messenger RNA vaccines since the first person was vaccinated here in the United States on December 14th and following the emergency use authorization. So we're certainly learning more about these vaccines. There are vaccines in the pipeline that we anticipate we could have emergency use authorizations here in the United States coming in the coming months. That's the AstraZeneca Oxford University chimp adenovirus vectored vaccine, as well as the Johnson & Johnson human adenovirus vectored vaccine. But what I'd like to just provide a brief overview is there was a very historical event yesterday where President Biden released a national strategy for the COVID-19 response and pandemic preparedness. And this is really our first comprehensive national strategy to combat this pandemic. And it has sections, obviously, that focus on vaccines. There are 7 goals that are outlined in this plan. The first goal is to restore trust with the American people, which is obviously critically important to getting high vaccine coverage. And the second goal is to mount a safe, effective, and comprehensive vaccination campaign. And I will outline that quite briefly. I know previously, Lainie, we've talked about what I've called the 4 Ds to a successful vaccination campaign: doses, delivery, demand, and data. And this plan addresses each one of these. In terms of doses, the plan is to ensure the availability of safe and effective vaccines, invoking in part the Defense Production Act to help produce some of those supplies that are really critical to getting vaccines into people's arms, such as needles and syringes and vials. The delivery component, obviously, this is where we've seen challenges in the United States, where we've seen more doses distributed than are actually administered to people. We're making progress. That proportion is slowly increasing. We're getting up into the high 40 percentile, 47% of doses distributed, delivered, but we still have enormous delivery challenges. And what the Biden plan lays out is really simplifying the allocation and distribution process, creating as many venues as possible to distribute to deliver the vaccine, including federally administered vaccination centers and federally supported vaccination centers outside of our traditional vaccination venues in healthcare facilities and pharmacies, creating the workforce to deliver these vaccines, really broadening the number of people who we can draw upon to deliver vaccines, providing the financial resources and compensation to states. And very importantly in this plan, Lainie, is focusing on hard to reach populations and ensuring equity. The third D, demand. There are plans to launch a national vaccination public education campaign, in part to combat, vaccine hesitancy that we see in some of the high risk, particularly hard risk hit groups, as well as just simplifying the process for scheduling a vaccine. And then that fourth D, data. The plan outlines strategies to bolster data systems, so we have transparency and can monitor our progress in vaccination, and very importantly, monitoring vaccine safety and efficacy going forward. There are still unanswered questions about these vaccines, including the duration of protection, and we need to be on the lookout for potentially rare adverse events. We've seen adverse events such as anaphylactic reactions or severe allergic reactions that were not seen in the phase 3 trials. So this is a really important milestone in our fight against the pandemic, having this national plan with a big focus on vaccines.
Thanks, Bill. I'm sure we will be speaking quite a bit about the Biden plan in the weeks to come. I'm now going to move into Q&A, and thank you to everyone who's been submitting questions. Bill, first up to you. How effective are COVID vaccines against these new strains that we're learning about?
Yes, this is a very important question, and we're learning a little bit. The truthful answer is we do not yet know fully what the protective efficacy of our current messenger RNA vaccines are against these variants. There has been some research where investigators have looked at some of the most important mutations, not the combination of mutations that are in these variants. These data suggest that our current vaccines will provide protection against these variants, but this is something that we're going to need to continue to monitor. These variants really arose as with increased transmissibility. There's strong evidence and increasing evidence that they're more transmissible. They did not evolve in response to selective pressure from the vaccines because we're just increasing the vaccine coverage. So we're going to need to follow this very carefully going forward. I would say right now we're optimistic that the current vaccines will protect against these variants.
Thanks, Bill. And speaking of these new variants, Brian, question for you. Can you talk us through what we know about the mechanism that actually makes these new variants more infectious?
Sure. So when we talk about variants, these are different strains of the virus that have accumulated a number of different mutations. And the ones that appear to be the most important to the infectivity of this virus relate to the spike protein, which we've all heard about, which is the main protein whereby the virus binds to human cells and then can enter those cells. And some of these mutations appear to make that spike protein, or the receptor binding domain of that spike protein, bind more efficiently to the ACE2 receptor, which is the receptor on our human cells that the virus uses to enter into the cells. And so when you look at epidemiologic data, it seems that some of these variants are spreading more easily through the population. And if you look in vitro in a laboratory, the affinity with, or the strength with which these new variants can bind to that ACE2 receptor is stronger. As Bill mentioned, there's no evidence that these mutations lead to a more severe illness from COVID-19, but the worry is that if more people are becoming infected, then obviously we're going to see more cases, and more cases means more hospitalizations and more people who have a risk of going on to severe disease or even death.
Thanks, Brian. Bill, question for you about the equitable rollout of the COVID vaccines. And could you share any observations that you've had so far in terms of disparities in the rollout?
Yes, I think we have seen disparities, and the way the system is set up, I think, or has been run, contributes to these disparities. We know, for example, that in many states, there's a very complex online process for getting an appointment to get a vaccine. And that kind of complex online process can be more challenging for disadvantaged communities throughout the United States. It can be just much harder for many individuals from disadvantaged communities to make appointments because of the complexity of the process. So I think we need to do a couple things in order to better address equity, and some of these are outlined in the Biden plan. But we need to make that appointment process and scheduling process much simpler. We need to bring the vaccination sites to the communities and create venues where people in disadvantaged communities, which, as we've said, have been particularly hard hit by the pandemic, where they can receive vaccines. And then finally, we need this public health education campaign to really combat any misinformation and disinformation and help build the trust in the vaccine. So there's the demand side. So there are a number of different things that we can do to address these inequities. But I think we've seen it in part because of just the way the rollout has gone and the complexities of that.
Thanks, Bill. So we've heard from you in this and other briefings that the COVID vaccines, we're not able to say that they block disease transmission. What we know from the clinical trials is that they can prevent severe disease. So what would it actually take for us to know that the vaccines prevent transmission?
Yeah, so there are a number of ways to try to get at this very important question. And you're exactly right, Lainie. The way the phase 3 trials were designed is that the primary endpoints or outcomes were clinical disease. I think, it may be a reasonable assumption if the level of virus, what we call the viral load, is correlated with symptoms, that if these vaccines reduce symptomatic disease, whether it's mild, moderate, or severe, that they're probably having an impact on viral load and thus making individuals less contagious to others. So I think we can make that assumption. But the studies going forward are really going to have to look at vaccinated individuals, identify whether they have asymptomatic or really minimally symptomatic infection, and so whether they get infected, and then contact tracing there to see whether they're actually transmitting to others. Those aren't trivial studies to do, but those studies are planned in the United States and ramping up, where we'll actually know whether these vaccines prevent asymptomatic infection and transmission.
Thanks, Bill. I'm going to ask you both to comment on this next question, and it's what advice do you have for those who are speaking with friends or loved ones who are hesitant or concerned about getting COVID vaccine? Bill, why don't you go first, and then Brian, I'll turn to you.
Yes, and this is really important, and I know many of us are facing this situation. I think the first thing is really to listen and try to understand what the concerns are. Sometimes that can be just there's a misunderstanding, or they don't have they have incorrect information or understanding about how these vaccines work and how the safety has been evaluated. So number one, listen, try to understand what the concerns are. The way I often think about vaccine hesitancy is that people often overestimate the risk of the vaccine and underestimate the risk of the disease. And so that, using that kind of simple framework in terms of, understanding what the real risk of COVID-19 is, and we see the tragic consequences of that in the United States, and also trying to understand what the risks of the vaccine are. And right now, the major side effects are fever and soreness at the site of injection, muscle aches, but those are transient. Those last just for 12 to 36 hours after vaccination, more common after the second dose. Some rarely, we are seeing some severe allergic reactions, but those can be managed.
Thanks, Bill.
And
Brian, over to you.
What I would say is that, a lot of the folks that I've talked to about the vaccine have been worried about safety. And I've been talking to them basically in the way that Bill has, and making sure that they understand that COVID-19 itself is a very serious illness. And while many people are able to have mild symptoms and don't require hospitalization, we have seen people across the spectrum from very, very young to very, very old getting hospitalized and dying from this virus. And that the risks of you getting COVID or transmitting it to someone that you love who then gets sick and dies far outweighs the potential, side effects that you might have from the vaccine in the short run. And, a lot of people have been expressing concern, well, we don't understand what the long-term outcomes of the vaccines might be. Well, to be very honest, we know that there are real risks to long-term complications from COVID. I mentioned earlier the number of people who are going to require months in the hospital or months in rehab, and even the young, healthy people who months after their infection have not returned to their baseline healthy states. That risk is real, and it's very high right now when COVID is this widespread in the community. And the benefits of the vaccine to yourself individually, but also to your loved ones and to your community, far, far outweigh any potential side effects from the vaccine. And right now, the only way we get out of this is if we all band together and we speak the truth, we share the facts transparently, and we all step up and we get vaccinated when we have the opportunity.
Thanks, Brian. Thanks to you both. Bill, another vaccine question. What do we know about protection from severe disease for those who have received just the first dose of a vaccine?
Yeah, so this too is a frequently discussed issue about the protective efficacy after a single dose. And first I'll say it's very important for people to understand that the evidence that we have from these large phase 3 trials that evaluated both safety and efficacy, the data are on 2 doses of full doses of the vaccine given at the pre-specified intervals. So when we move beyond that, and there's a lot of discussion around that, we're on much softer ground in terms of the evidence. But there were individuals in the trials who got just a single dose. And because of the intensity of the epidemic, we were able to have some estimate of protective efficacy after a single dose for the short term. And so, for example, for the Pfizer vaccine, there was evidence of protective efficacy between the first and second dose. That doesn't start until about 12 days after the receipt of the first dose, and they measured about an 80% efficacy. But we have no idea how long that efficacy lasts. The antibody data, where we look at antibody levels, we know from that the antibody levels are lower after a single dose than after 2 doses. That's one of that's the big advantage of the second dose. So although there is some protection that accrues after a single dose, we don't have good data on that, and we don't know how long that protection will last.
Thanks, Bill. And a different but related question. For those who have tested positive for COVID-19, what should they be doing relative to the vaccine?
Yeah, so the current recommendations are that people who've had COVID-19 should still be vaccinated. That may be somewhat counterintuitive, but we don't know as much about the immune responses after natural infection. It's quite variable. We know a lot about the immune responses after 2 doses of both the Pfizer and the Moderna vaccines, and we have obviously confident that it offers 95% protection. So the recommendations are that that even with a prior history of COVID-19, one should be vaccinated.
Thanks, Bill. Brian, as we've spoken so much about vaccines lately, it seems like we're hearing less about hygiene, hand washing, avoiding touching one's face. Can you comment on the continued importance of those measures?
Sure. I think it's going to be some time, even with the rollout of a national plan and trying to ramp up production of vaccines. It's going to be a really long time before the vast majority of the population gets vaccinated, right? And so for the coming months and for the foreseeable future, we have the ability to control the spread of the virus with measures that we know work. So I think mask wearing is probably the most important. Avoiding large gatherings, particularly indoors, is equally important. I think early on, we really didn't understand how this virus spread. So we definitely focused a lot on, cleaning surfaces and washing hands. Those are still important. They're probably not the main way that the virus spreads, but it's still really important to wash your hands and to maintain overall good hygiene, because, while COVID is out there right now, there are other viruses that thankfully we haven't seen a big spike in flu season, for example, this year, but there are other viruses that we know can spread that way fairly easily. And so it makes sense to wash your hands, maintain good hand hygiene. But I think most importantly right now, particularly now that we know that there are these other variants that can spread more easily, being really attentive to wearing a mask and avoiding high risk situations, which include large gatherings or gatherings indoors.
Thanks, Brian. Bill, we hear a lot about vaccines and the spike protein. Can you talk us through other vaccination work that's being done that is not necessarily focused on the spike protein?
So currently, all of the COVID-19 vaccines are really focused on the spike protein, and the reason why is that, as Brian said earlier, it's that spike protein on the surface of the virus that binds to our host cells and allows the virus to enter. Now, there are various ways of inducing immune responses to the spike protein, and that so we have the obviously the messenger RNA vaccines and the adenovirus vectored vaccines. Those are the ones that are furthest along, and those basically program our own cells to make the spike protein, which our immune system then responds to. But there are other approaches where you just take the whole virus and inactivate it or kill it, if you will, or you have just the spike protein, the Novavax vaccine, for example, and there are other protein-based vaccines where you're just administering the protein itself rather than the genetic code or recipe for it. So all of the current vaccines are focused on the spike protein. They're just different strategies for inducing immune responses to that protein.
Got it. Thanks, Bill, for that clarification. Additional question for you. Do we know anything about potential protective efficacy for babies who are breastfeeding and the mom has been partially or fully vaccinated against COVID?
Yeah, so the short answer is no, we don't know that. That one of the key areas of research in the coming months will be assessing the safety and efficacy of these vaccines and other vaccines for COVID-19 in pregnant and lactating women, as well as in children. The way moms actually protect their infants most is through the transfer of antibodies from their blood system into the baby through the placenta. So that's going to be one way, actually, young children will receive antibodies from their mom. But there are important, many important immune functioning substances transferred during in breastfeeding as well. But I think we haven't seen significant severe disease in very young children, but I would think it would actually be through the placental transfer of antibodies that young infants would be protected, and that's what we see with other infections such as measles, for example.
Thanks so much, Bill. We are coming up on 12:30, so I'm going to wrap up. I'd like to thank Brian Garibaldi and Bill Moss for joining me today, and give a big thank you to everyone who joined us, and especially to those who submitted questions for our experts to answer. This briefing will be archived and available on coronavirus.jhu.edu. And as a reminder, we'll be offering regular 30-minute briefings on Fridays at 12 p.m. In each briefing, we'll focus on what you need to know right now about the COVID-19 pandemic, and we will have live Q&A with our experts. I'll look forward to seeing you at our next 30-minute briefing. Until then, thanks and stay safe.